So today I'm going to tell you a story about how a group of friends and I, Peace Corps colleagues, started a sexual and reproductive health hotline that uses text messaging to send out sexual and reproductive health information to youth in Nicaragua. So how did this happen? Well, first, we had an idea. This is my Peace Corps community. It's a town called La Dalia in northern Nicaragua. And this is actually my street. I lived about a block away from here in a house that looked just like this, but it was pink. And so in Nicaragua, 1 out of 4 adolescent girls will become pregnant before they reach the age of 19. But in communities where a lot of Peace Corps volunteers were serving, including my own community, the statistic rises to 1 out of 3 girls. So this is a picture of my host family. And I love them dearly. I lived with them for about 6 months. We're going to try to use the laser pointer here. So here is Doña Albita. She's my host mom. Her daughter, Marjorie, is the one in the yellow there. Marjorie's son, Elian, is the one with the Barcelona jersey in front. And her daughter, Allison, is the one with the teal. And Allison's daughter, Nicole, is the one that she's holding. And so I'm showing you this photo because it's 4 generations in one photo. My host mom, Doña Albita, is in her mid-40s, and she's already a great grandmother. Doña Albita had Marjorie when she was 16. Marjorie had Allison when she was 16. And when Allison was 15, at the very end of my service, we found out that she was pregnant, and she gave birth to Nicole shortly after I left. So I'm showing you this picture to kind of demonstrate the cycle of adolescent pregnancy that we see in Nicaragua. And also to highlight some of the barriers that face youth, because my host mom, Doña Albita, worked in the health center in my town, yet Allison wasn't using family planning. She felt like she couldn't access it, and she got pregnant. And so this is happening across Nicaragua, and we wanted to know why. Why is this happening? So when starting to think about this problem, I want you guys to take a minute to kind of think back to when you were teenagers. And how did you access sexy information? If you had a question about sex, or maybe your friends were chatting and they threw out a term and you just had no idea what it meant, how did you look for this information? Well, nowadays, people can turn to Google. And you can be like, Google, what do I do if he doesn't want to wear a condom? And Google will throw out about 1 billion hits in under a second. And for some reason, Google always wants to tell you this statistic. I'm not really sure why, but they always do. And so if you think about how much information is available so quickly, well, frankly, it's kind of ninja-like. And so just for juxtaposition purposes, I took this picture. It was at a health fair right outside of my town. And the person sitting in the table is a nurse handing out family planning methods. So literally everyone and their mothers are there. And so think about when you were a teenager and maybe you wanted to get family planning methods, or maybe you just wanted to ask a simple question. You're not going to want to do it where everyone can see you. And so it's not exactly an anonymous situation. So how do people in Nicaragua access sexy information? Well, according to official statistics, only 14% of households have internet. But I actually found out that most youth are using their cell phones to log into Google and ask the same type of questions. The only thing with their cell phones is that just sometimes in rural communities, the connection is a little bit slow and inconsistent. So we saw that adolescent pregnancy was an issue. We saw that youth loved to use their cell phones. And we realized the power and potential of cell phones in Nicaragua and the anonymity that they provide youth. And so we decided to take this idea and create something with it. So we created this thing called ChatSalud. What is it? It's this automatic system where anyone with a cell phone anywhere in Nicaragua, it doesn't have to be a smartphone, it can be a little flip phone, can text text a code to the number of ChatSalud, and in response, they'll get a menu of options. It'll be like, welcome to ChatSalud. For HIV, press 1. For family planning, press 2. For safer sex, press 3, et cetera. And they'll be able to have this conversation with the system and access the information that they want and need. So we had this idea, but how do we actually go about implementing it? Well, the whole first year of this idea was spent building partnerships and getting people to get really excited about it in Nicaragua, because we couldn't do it alone. We were just a couple of Peace Corps volunteers. So our big break came in January 2013 when the World Bank invited us to a hackathon. And I don't know if anyone's heard of what a hackathon is, but it brings together techies with health experts in this case, and you team up together and you come up with a technological solution to a problem. So we teamed up with a group of computer science students from the university in Nicaragua, and we started working together to build up the ChatSalud platform. And after 48 hours of working tirelessly on this, we won. And so what does this actually translate into? Well, the World Bank hooked us up with all the major stakeholders in Nicaragua that work in sexual and reproductive health, and we pitched our idea to them. And at the end of the meeting, we formed committees with these people, and they're still our partners today. One of the committees, it's really important, they helped us develop the content of the text messages. So we worked with Nicaraguan experts in health to develop the messages that went out, that are going to go out to the youth. Another major partnership are with the telecom companies, because what good is a service, a sexual and reproductive health service, if people can't access it for free? So we have one telecom company that is super on board, and they're going to provide free text messaging to anyone who uses their service. The other one we're still working on trying to get, so hopefully that'll work out. But if we get both of them on board, then ChatSalud will be free to everyone in the country, including us, which we like. We're teaming up with a marketing firm, and they came up with a bunch of radio slots and TV ads and posters for us, and this is my favorite draft that they gave us. It essentially translates to, that's not how you use it, and goes on to explain how to access ChatSalud. And I'm also very excited to announce that we have an official partnership with Planned Parenthood and with the Red Cross. Now, the Red Cross in Nicaragua has been our ally this entire time. We went at the very beginning stages of our idea, and we pitched it to them, and they've been with us since the very beginning. Now, Planned Parenthood just decided to fund a position through the Red Cross. So we actually just hired someone who's going to run the entire operation on the ground, which is very exciting. They're starting May 5th. I can't wait. So that's huge. So we have partnerships. We have people on board. But the other major component of this is we have to make it relevant to the user, and we have to make sure that this product, this idea, is actually what people want. And so the whole second year of this project has been about building the evidence. So after we developed content through the content committee, we reached out to Peace Corps volunteers all across the country in Nicaragua who already have youth groups. And we had them test out the content with their youth groups. And so this is a picture of a Peace Corps volunteer named Helen, and she's holding up a paper prototype of the cell phone with the content on it. And she had the youth go through all of the content and actually pretend to push the buttons, so we could see if youth liked the content and if they understood how to use it to make sure it was user-friendly. Okay. So the best part about going to grad school right after service, I'm advocating for this, is that I was able to jump right in with my grad school research and do research on ChatSalud. So I got back a year ago, and I'm in an accelerated program at Johns Hopkins getting my Master of Public Health. And I was able to get funding and travel back to Nicaragua over the winter. And I worked with a team. This is my team. So Lindsay Leslie, she was a Peace Corps volunteer with me in Nicaragua and is my current housemate, and she's another student at Johns Hopkins with me. So she traveled to Nicaragua as well, and then the guy here is William Garcia, and he's my friend from my Peace Corps community. Together, we carried out 42 interviews in 4 different areas of Nicaragua and asked youth about how they access sexual and reproductive health services, how they look for information, and then we had them test out ChatSalud on a little demo on an actual phone, and we got their reactions to it. So here are some results. If I'm not married and I want to be with my boyfriend, I have to look for birth control in other places because if I go to the health center, everyone will find out. In our town, adults go to the health center more because us youth are embarrassed to go to the health center to ask for condoms. And this is my favorite quote out of the entire thing. Texting is kind of like my hobby. So the study kind of confirmed a lot of the barriers that we had experienced anecdotally, and now we have an evidence base behind it that we can show our stakeholders to show them that we're actually doing something right with this. We also had a mini pilot, a small pilot among 25 youth in a rural town in Nicaragua, and where they were actually able to try out ChatSalud for a 3-week period. And the purpose of this was to kind of work out the kinks and to make sure that people understood the content and that it was good. So that was also very successful. And now, year 3, we're just wrapping up year 2. ChatSalud started right around Passover time 2 years ago. So we're just wrapping up Passover this year. And so we finished 2 years, and now we're hoping that in this 3rd year, we can actually launch. And so I just want to conclude by showing you this picture of the original Peace Corps ChatSalud team. And I want to wrap up by saying, kind of to reiterate what Matt was saying earlier, that this is a really short presentation. I can only show you the highlights. I don't have time to talk about the failures. But there have been a lot of failures. It's been a really turbulent road, and it's still gonna be turbulent. It's been 2 years, we haven't even started yet, and then our work will really begin. And so as you go off to your Peace Corps service or grad school or jobs, you're gonna run into hard times. And if you can face it with persistence and determination, even in the face of failure, and if you engage with your community, you're gonna be amazed at what you're able to accomplish. Thank you.